Hello again. So, for another gynecologic oncology disorder, we will tackle about the cervical and uterine cancer. So, let us move further with the anatomy or the basic anatomy of the female reproductive system. So, as you can see here on the photo that is shown on the slide, alright, so we have here the highlight of our discussion, which is the cervix and the uterus. Alright, so as you can see, this is the ovary or the female ovary, and this is the fallopian tube. Okay, these are the ovary, and this is the fallopian tube. Fallopian tube, and this is the uterus. Okay, and the uterus, it has the different several sections of the uterus. This is the fundus, kung saan siya yung pinaka wide at pinaka mataas na portion ng uterus. Okay, and also you have the corpus, which is the main body or the corpus layer of the uterus, which is the main body, kung saan dito po pumupunta yung mga fertilized egg na nanggagaling po sa ovary. Okay? And at the same time, meron din tayong isthmus kung saan dito nagnanarrow yung uterus, no? At of course, the pinaka last portion is cervix. Okay? So, in uterine and cervical cancer, nagkakaroon po ng affectation or nagkakaroon ng abnormality sa cells, okay, ng cervix and uterus. So, unahin muna natin si cervix. Ang cervix kasi usually has two layer. You have the ectocervix and the endocervix. Okay? Si ectocervix, guys, take note, si ectocervix is always comprises of the squamous columnar. Okay? So, ectocervix is actually comprises of stratus or stratified squamous epithelium. Okay? I'm sorry, this is stratified squamous. So, exocervix is comprises of a stratified squamous epithelium. So, meaning to say, when we talk about an stratified squamous epithelium, this is comprises of many layers of um, flat and thin cells. Okay? Now, another layer of the cervix is the endocervix. Okay? So, endocervix naman, unlike sa ating ectocervix, endocervix is comprises of your um, simple columnar epithelium. Okay? So, iba ang structure or iba ang epithelial type or tissue ni endocervix kay ectocervix. Okay? Kung si ectocervix is comprises of stratified squamous, si endocervix naman is more on simple columnar epithelium ang kanyang structure. Okay? So, si endocervix naman is also since it is comprises of simple columnar, and most commonly, kapag ang isang organ is comprises of columnar type of tissue, it is secreting organ. Meaning to say, it secretes mucus. Okay? That is for endocervix. I repeat, the two cervical regions is ectocervix and endocervix. Ecto ectocervix is the outer portion that comprises of a stratified squamous, and endocervix is the innermost portion that comprises of simple columnar epithelium. Now, when we talk about a columnar type of tissue, this is responsible of secreting mucus. Okay? And for cervical cancer is a type of cancer that occurs in the cells of the cervix. Okay? So, the lower part of the uterus that connects to the vagina. So, meaning to say, guys, nabanggit natin yan kanina. Okay? The uterus has different layers. You have your fundus, corpus, isthmus. This is isthmus. And the lower portion of your uterus, that is the cervix. Okay? So, various strains of the HPV or the human papillomavirus causes this type of cancer. Okay? As you can see, as we have already mentioned this last time, that human papillomavirus is an oncogenic type of virus. Okay? So, HPV is a type of virus which is oncogenic. Ibig sabihin, it has the higher chances and it causes cancer. Well, this is a type of STD or sexually transmitted disease which is primarily transmitted via sexual intercourse, no? Ang ginagawa nito, once you have had this type of virus, it causes genital warts, no? And most especially, ang pinaka worst thing, it causes cancer. Okay? So that is why human papillomavirus has the higher risk of transmitting, or it has a higher risk of developing cancer. So types of cervical cancer, the type of cervical cancer that you have helps determine, of course, the prognosis. That is why it is very important for us to have some screening, and also we have to identify what type of cancer does the person has para malaman natin yung appropriate treatment and of course the prognosis or the chances of survival, no? The chances of survival, that is prognosis. Okay? And treatment. So what is the appropriate treatment of the patient, no? Kung mas intense is more on surgery, and if the patient or the cancer is confined to a specific place only, baka pwedeng idaan na lang din muna sa lymph dissection or biopsy or even radiation therapy. Okay? So the first type of cancer in the cervix is the squamous cell carcinoma. Okay? So squamous cell carcinoma is a type of cancer. All right? So squamous cell carcinoma is a type of cancer that affects the ectocervix. Okay? This type of cervical cancer begins in the thin flat cells or squamous cells lining the outer part of the cervix. Now, nasabi natin kanina, balikan natin yung picture. The cervical region, we have the ectocervix. And when we say ectocervix, this is the ecto means outside. Okay? So, ecto means outside. It pertains to outside or outside layer. And sabi natin ngayon that ectocervix is comprised of stratified squamous. So when you say squamous cell carcinoma, it is the ectocervix that is affected. Okay? And which projects into the vagina. Most cervical cancers are squamous cell carcinoma. So basically, majority of the cervical cancer patients are on squamous cell carcinoma in origin. Okay? And adenocarcinoma is the second type of cancer. Okay? So adenocarcinoma is the second type of cancer. This type of cervical cancer begins in the columnar-shaped glandular cells that lines the cervical canal. Okay? So nabanggit din natin guys, no, when we talk about adeno we pertains to glands. And glands are the ones that produces or organs that produces a product. Produces or secretes a product. Well, if we talk about the columnar shape, then we are pertaining to the endocervix. Because endocervix are made up of a simple columnar type of tissue. Now, binanggit din natin kanina that if the endocervix is made up of columnar, and some of or majority of the columnar type of tissue always produces a product. And what product is this? Columnar epithelial tissue always produces a mucus. And take note that endocervix is the structure or region of the cervix that produces mucus. Okay? So, adenocarcinoma, adeno means glands. And glands always pertains to organs that secretes a product. And what product am I referring to? The mucus. So endocervix are the ones that are capable of producing mucus. So these are the two types of cervical cancer, adenocarcinoma and squamous cell carcinoma. Squamous cell pertains to the ectocervix or the outer region, and adenocarcinoma pertains to the innermost region or endocervix. Okay? Risk factors, many sexual partners, the greater your number of sexual partners are. That is why the most common risk factor is the multiple sexual partners. Okay? The greater your number, the sex of the sexual partners, the greater your partner's number of sexual partners, the greater you are acquiring an human papilloma virus. Take note that human papilloma virus is a sexually transmitted disease that causes cancer. So the more sexual partner, the higher the chances of transmitting or acquiring an STD. And the higher the STD is, the higher the chances that you will get this type of cancer as well. So early sexual activity, so this is more on engaging in a more premarital sex or more engaging at sexual intercourse and the younger ages, no, less than 20 years of age. Having sex at an early age increases, of course, your risk of human papilloma virus. Other sexually transmitted infections, having STIs like your chlamydia, gonorrhea, syphilis, and HIV or AIDS increases your risk of HPV. Okay, so a weakened immune system as well could be a contributory factor of acquiring this type of cancer as well. So you may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. Take note, the lesser the activity or immune system of your body, then most probably antigen will boost its number. Kasi nga, walang antibody na pumapatay sa kanila. So, parang it enables viruses to multiply in your body. Like HPV, increase in HPV, increased development of cancer. So, why are you getting virus? It's because your immune system is not functioning well. Mababa ang immune activity. Okay? Weak immune system. No antibody activity is noted. Okay? And at the same time, no antigen recognition. Okay? So, pathophysiology, cervical cancer begins when healthy cells in the cervix develops. Of course, walang kamatayang mutation or abnormal DNA mutation. Okay, a cell's DNA contains instructions that tell a cell what to do. Now, healthy cells grow and multiply at a set rate. So, given for example, no, kapag healthy cell yan, so normal cell has a set time frame. No? Now, once the mutation occurs or commences, then the cell will now grow and multiply out of control. So, ibig sabihin, regardless of the size or whenever the cell reaches this certain size or shape, then it will grow further and further. Okay? Out of proportion, they grow and grow and grow because there is no one suppressing the growth. Since in cancer, the tumor suppressor genes or the TSG is inactive, no? Bakit out of control? It's the tumor suppressor gene. The tumor suppressor gene are not active or hindi po sila present. And oncogenes has increased its number as well. That is a positive regulator of cell. Okay? So these are the examples of HPV. So makikita natin there is a formation of a genital warts on the affected person that would predispose the person to developing cervical cancer. So, staging of cervical cancer, it always varies whether the cancer has been spread in the adjacent tissues or adjacent parts of the reproductive system, or the worst part is that not just in the pelvic region but also in the other parts of the body has already reached by the cancer cells, no? So, in stage 0, carcinoma in situ, ayan. So, namit na ulit natin si carcinoma in situ. Now, when we talk about a carcinoma in situ, it is where the cancer cell is only confined to the place of origin to which they are formed. Okay, so ibig sabihin, kung form siya doon sa epithelial lining ng cervix, doon lang po siya naka-stay or nagre-reside. So, they do not multiply or they do not spread all throughout the rest of the cervix or all throughout the rest of the reproductive system. No? So, 100% survival rate of this when the patient is classified under stage 0. But in stage 1, hindi lang siya sa lining, but of course, the entire cervix has already affected. Okay? So, 85% pa rin ang survival rate, okay pa din. Alright? Now, when we talk about the stage 2, okay, the disease or the cancer beyond cervix but not to pelvic wall or lower one-third of vagina. So, ibig sabihin, the cancer has spread not just in the whole cervix region but also it has reached the one-third of the vagina. Okay? And on the stage 3, the disease or the the um the cancer has already reached not just the uppermost portion of the vagina, but also the lower one-third of the vagina has already infected or affected. That is stage 3 cervical cancer. And of course, ang mahirap din dito is even the pelvic wall is already affected. Now, when we talk about the stage 4, hindi lang yung pelvic wall, hindi lang yung vagina ang affected, but also there are some metastases on the rectum or in the lower portion of the large intestine is already died. Okay? So these are these different stages of cervical cancer. Now for assessment findings, the person might feel fatigue. That is the most obvious subjective or that is the most common subjective complaint of the patient. So mabilis mapagod, nawawalan ng ganang kumain, and of course generalized body weakness or body malaise, and of course pelvic discomfort since there is already an affectation of the pelvic muscles or pelvic walls, no? Objective cues, so we can assess that the person might be suffering from weight loss. So we have already discussed why patient with cancer is suffering from weight loss, no? It's because the tumor steals the sugar that is supposedly utilized by the healthy cells. So they are strong competitor. So they compete with the healthy cells by gathering or by getting too much nutrients coming from the food that the person eats. Anorexia or loss of appetite, vaginal bleeding or vaginal bleeding after intercourse. So it is bleeding coitus between periods or after menopause. Watery, bloody vaginal discharge that may be heavy and also have a foul smell or odor. And pelvic pain or pain during intercourse that might signify that the cancer cell has already spread, not just in the cervical region but also on the walls of the cervix or in the walls of the pelvis. Okay? And kapag nagkaroon ng bloody vaginal discharge, that might also signifies that the cancer cells has already reached the one third of the uppermost part of the vagina or even the whole vagina itself has already um, affected by this type of cancer. Okay? Special notation, surgical removal of the cervix that we call a trachelectomy. Okay, that is trachelectomy. This is the cervical region or we simply also call this what as a cervicectomy. No? So, pwede rin po yan. We can also call this term as the cervicectomy. This is actually a type of a surgical approach kung saan very beneficial to sa mga taong infected with cancer that has still a plan of um, childbirth, or they are having a plan to have a baby someday. So it's like more on a this is more on the fertility preserving type of surgery, no? So na-preserve pa rin natin yung fertility ng pasyente, or um, the chances that the patient might also get pregnant in the future. Fertility sparing ang tawag natin dito sa technique na yan. Okay? Hysterectomy. Okay, so hysterectomy is also, this is a type of a procedure kung saan the uterus is being removed. That is hysterectomy. Okay? Now, you have to only also, a part of your nursing education or nursing responsibility is that whenever the person will be having a hysterectomy or the removal of uterus, you have to inform the patient that there will be no menstrual cycle. The person might not be experience menstruation anymore, or the person might not be able to get pregnant already. Okay, so hindi na po, there will be a, you have to inform the patient that maapektuhan yung menstruation cycle niya. So, the person might not be having periods at all. And of course, the person ability to get pregnant is also, lost. So, there will be a chance of not getting pregnant, no, at all, no, for the rest of her life. Okay? Well, it is actually a this is a prophylactic surgery. It's because if they are suspecting of metastasis of the cancer in the uterus, so pwedeng yung cancer cell has already reached the uterus, then most probably they will remove the uterus. Well, you have to inform the patient na hindi na po siya kailanman magkakaroon ng baby kapag natanggal yung uterus, kasi the uterus is where the fertilized egg or the fertilized egg will be implanted, and as the baby grows, doon po siya ngayon, yun yung magiging bahay ng bata or ng baby, no, yung growing fetus. If you remove the uterus, then there will be no structure, no, wala pong mag-house nung fertilized egg, no, there will be no house for the growing fetus, so wala na pong chances na pwedeng ma-pregnant or ma-impregnate ang ang pasyente. Okay, so it's your responsibility to inform the patient about this worst side effect. Lymph node dissection, ayan, so we will gonna have lymphadenectomy, so we will gonna check whether there are some presence of malignancies in the nearest lymph nodes, no, adjacent to the female reproductive organ, like common iliac arteries or iliac regions, ano, yung obturators, ayan, okay. Radiation therapy, ayan, and to decrease the size of the tumor, oxygen therapy, and high protein, high calorie diet. So, surgical approach done for cervical cancer is surgical procedures like total hysterectomy. So, total hysterectomy, so I have already mentioned this. This is the full removal of the uterus. So, the uterus will be removed. Inform the patient that the patient might not get pregnant anymore, and the patient will not, of course, menstruate. Okay? Cervix is also removed, and ovaries are also removed as well. And radical hysterectomy naman, guys, take note that radical hysterectomy, this is the more aggressive approach, no? Mas aggressive siya in the sense na hindi lang yung uterus ang tinatanggal niya yung ovaries, or even the fallopian tubes are also removed. The proximal vagina is removed, and bilateral lymph nodes through an abdominal incision is done. Okay? Now, this is where, kaya nga siya nagiging radical, because radical means there is an extensive area or extensive excision or removal of paravaginal area. When you see paravaginal, these are the tissues that are nearest, or it is located on the adjacent portion of the vagina. So, yung tissue that wraps or surrounds the vagina is also removed. That is para vaginal. Para cervical, so lahat ng mga tissues that is wraps or surrounds the cervix is also removed. Parametrial or the endometrium part of the uterus is also removed, and uterosacral tissues is removed within the uterus. Kaya nga siya mas mas aggressive ang radical compared sa total hysterectomy. Aggressive. No? Kasi ang daming tinatanggal dito. Radical vaginal hysterectomy naman, hindi abdominal incision but rather more on the vaginal part ang inukuha, no? Vaginal removal of the uterus, ovaries, fallopian tubes, and proximal vagina. Okay? Bilateral pelvic lymph adenectomy, so removal of the common iliac. So these are the types of lymph nodes that are adjacent to the female reproductive organ, no? An obturator. Now, we need to do this in order for us to assess, no? We need to remove in order for us to assess or to check for the presence of malignancies. Malignancies in the lymph nodes. Lymph nodes affecting the iliac, external iliac, hypogastric, and obturators, lymphatic vessels. And also, we are going to perform this type of surgery or approach in order to assess for metastasis. So, kailangan natin gawin to. We need to assess the lymph nodes nearest or nearby of reproductive organs, female reproductive organ, just to check baka nag-metastasize na ang cancer cells sa mga upper portion ng abdomen. Okay? Radical trachelectomy is, nabanggit na natin, this is a type of a fertility sparing type of approach or surgery kung saan if your patient is less than 40 years old and they're still planning to have a baby someday, then this is the best approach for them. No, this is a fertility approach or fertility sparing surgery. No? Kung saan we are preserving the uterus. No? Kinakailangan natin 'yan in order for the patient to get pregnant someday if ever kids gusto pa rin po nila. Alright? Okay, so ito yung ginagawa natin yan. Okay, so if ever they have the desire to preserve fertility or kung gusto pa nilang magkaanak someday, then this is the best option that we could offer to them. Okay, that is radical trachelectomy. Okay, so this is the best option. Okay. So, laboratory and diagnostic findings is the pelvic exam. So, nabanggitan natin si pelvic exam during the discussion of ovarian cancer, no? So, pelvic exam this is done by the doctor or OB-GYN. The doctor will have an inspection, no? Inspection of the female reproductive organs. Lahat titignan yan, vagina, uterus, fallopian tube, ovaries, cervix, and so on by means of the speculum. Okay. Pap smear is also Papa Nicolau test. Okay, the other name for this one is the Papa Nicolau test. Ayan. Kaya nga siya tinawag na pap smear. Ayan. So this is when all women aged between 21 and 65 years old are advised to have this type of exam, no? That is a pap smear. Okay? So ang ginagawa dito sa pap smear is that it is performed by opening the vagina and of course by use of the speculum para ma-retract, no? And they will collect cells. Okay? So, magko-collect sila ng cells coming from the cervix. Okay? And of course, they will gonna send these cells or collected cells will be sent and perform tests under the microscope and look for abnormalities. So, ang ginagawa natin dito is we are trying to detect whether there are series of lesion or when there is a neoplasm sa cervix, no? Makikita yan via microscope. Okay? And makikita din natin whether nagkakaroon po ng gas-gas doon sa epithelial lining or squamous epithelial lining, okay, ng ectocervix. Ayan, so makikita natin yan. Well, if ever, during the pap smear, once the doctor um, once the doctor has confirmed that there is a presence of lesion on the epithelial lining of the ectocervix, that most probably means that the person has had a past human papilloma virus infection before. And just like what I have told you, once the patient had a human papilloma virus infection, then most probably that would predispose her in the development of cervical cancer. So once pap smear is done, and if the doctor has seen that the squamous lining of the cervix of the patient has been um, had a series of lesions or gas-gas, that might be caused by human papilloma virus. Okay? So that is how pap smear is very important in the confirming or in screening the patient of cervical cancer. Okay? Another one is HPV DNA testing or human papillomavirus DNA or deoxyribonucleic acid test. This involves testing cells collected from the, ito yung sinabi ko kanina, no? So, this is where collected cells coming from the pap smear will be sent to the laboratory and they will gonna check it under the microscope. Okay? And we will have to check for the presence of HPV. Okay? Biopsy is confirmatory tests and ultrasonography in order for us to check for the size and shape of the mass, no, how extensive the mass is growing, whether it affects other organs or even the epithelial blood vessels or lymph nodes, no, CT scan to check for the metastasis, and MRI and positron emission tomography scan. So itong positron emission tomography scan is actually very helpful, ito yung PET scan, no? Very helpful yan kasi itong PET scan na to, PET scan makes use of sugar. Positron or positive emission tomography is sugar based. And sugar, tumor cell always loves sugar. And once you have had this PET or positron emission test scan or tomography scan, what will happen now is that kapag nagkaroon po ng collection of sugar into the specific part of the person's reproductive system, then most likely may tumor doon. Kasi ang sabi natin, tumor loves sugar. And once sugar is being utilized at naka-confine lang siya sa isang lugar, under the scan, nakita natin na there is a collection of sugar into that specific part of the person's reproductive organ, like in the cervix, most probably may presence ng tumor dyan. Because tumor loves to steal sugar. Okay? So that is the role of the PET or positive or positron emission tomography scan. Okay? And hormonal therapy is tamoxifen. Now, we have already mentioned this a while ago. No, tamoxifen is a type of an estrogen, okay, or anti-estrogen and estrogen receptor modulator. Okay? So, ang ginagawa ng tamoxifen is that they block the receptor sites of estrogen receptor. Thereby, they prevents binding. So, piniprevent nila ang binding ng estrogen sa receptor sites. Okay, ulit natin ha. So, once receptor sites are blocked, estrogen cannot bind at all. Thereby, cellular growth is impossible. So, mas nako-control natin ang pagdi-divide at pagdami ng cancer cell once we have already blocked the receptor sites of estrogen. That is the role of tamoxifen. Okay? And anastrozole naman is actually it actually inhibits or it controls, so it controls the production of estrogen. Hindi niya hinaharangan ng receptor sites, but it only controls the production of estrogen in the body. Okay? Administer analgesics like morphine and fentanyl. So we have already discussed the nursing protocol if you're about to give as morphine. Okay? So uterine cancer naman tayo. Okay? So in uterine cancer naman, this is where we are focused in the uterus, no? Now, what is cancer of the uterine endometrium? Take note guys that in uterus kasi, ano ba ang pinaka-function ng uterus? Number one, pregnancy, no? Ang uterus, nakakatulong yan if the person got pregnant kasi nag-stretch ang uterus ng pasyente if the baby is already growing, no? Okay? And especially if there is a fertilization of egg by the sperm, yung fertilized egg will now be implanted sa inside the uterine body, no? O yung ang tawag natin diyan is the uterine body is the corpus, no? Kung saan diyan po na i-implant yung fertilized egg, and it will now be, kung saan mag-grow ang baby. And of course, dito rin po nanggagaling yung mga tissue and blood that is, lumalabas whenever the person is menstruating. So, marami yan. Pregnancy, fertility, and menstruation. Yan lagi ang pinaka-role na uterus. And of course, ano ba ang layers ng uterus? Usually, may perimetrium dyan. This one. Ayan. No? So, this is the fundus. Yung pinaka-upper portion, this is the body. That is fundus. This is corpus, isthmus, yung narrowing, and this is the cervical area. Now, in the uterine muscle or in the uterine walls or layers, we have different layers. We have 3 layers of the uterus. The perimetrium, this one, is the outermost. This is the outermost layer of the uterus. Endometrium, this is the muscular layer. Okay? This is the muscular layer. Kung saan siya yung nag-expand kapag ang endometrium siya ang I'm so sorry. Endometrium, guys, I'm so sorry. Endometrium is not the muscular layer, it's the myometrium that is muscular layer. Ang endometrium layer naman is the one, okay? Ang endometrium is the innermost lining. Okay? Endometrium is the innermost lining of your uterus. Okay? And of course, ito yung sinasabi ko kanina, that myometrium is the muscular layer. So, in short, myometrium, myo means muscle, siya ang nagko-contract, no? This is the one that is expand whenever there is a growing fetus. So, as the baby grows and as the pregnancy, as the pregnancy progresses, the myometrium is the layer of the uterus that is expanding in order to accommodate the growing fetus. And at the same time, the myometrium is the one that contracts when the baby is about to be born, no, during childbirth. Okay, that is the structure, no? So, in the cancer of the uterine endometrium or the innermost lining, endometrium is the innermost. No? Fundus or corpus has increased in incidence partly because people are living longer and because reporting is more accurate. Most uterine cancers are endometrioid. Endometrioid is the innermost lining. Okay? After breast, colorectal and lung cancer, endometrial cancer is the fourth most common cancer in women and the most common pelvic neoplasm. Cumulative exposure to estrogen. Take note again, no? Very bida ang estrogen sa cancer in reproductive or gynecologic cancers, no? Major risk factor lagi si estrogen. So, these are the structures of the uterus. Perimetrium is the outermost. Endometrium is the innermost. So, ibig sabihin, endometrial cancer is the most common type of uterine cancer. Okay, and myometrium is the muscular layer. So, risk factors, at least 55 years, median 61 is the middle, or the, the mean or the median age. Postmenopausal bleeding, obesity that results in increased estrogen levels. So this is related to excess weight resulting from conversion of androstenedione to estrone in body fat. So malaking factor ang obesity, no, sa pagkakaroon ng uterine cancer, which exposes the uterus to unopposed estrogen. And unopposed estrogen therapy, estrogen used without progesterone, which offsets the risk of unopposed estrogen. Ito yung nagtitake siya ng estrogen without taking in combination with progesterone. And nulliparity, ibig sabihin ng nulliparity is the person that has never been pregnant. No, hindi pa siya nagkakaroon ng baby, hindi pa po siya naging pregnant. Okay? Or hindi pa nabubuntis. Truncal obesity, ito yung type of obesity kung saan mas maraming fat deposits sa abdomen compared sa extremities. No? And of course, late menopausal, like after 52 years of age, and possibly use of tamoxifen, or this is an anti-estrogen type of hormone. And assessment findings, endometrial aspiration or biopsy, and ultrasonography is endometrial aspiration is there we are getting sample of tissues or cells in the endometrial lining of the uterus or the innermost lining of the uterus kasi yun yung pinaka common type of uterine cancer. And ultrasonography. Okay, medical management, treatment of endometrial cancer. Okay, so treatment of endometrial cancer is actually consists of total hysterectomy. So, nabanggit na natin yan. Total hysterectomy is the removal of the uterus, the cervix, and the, what else? The fallopian tube, ovaries, no? And bilateral salpingo-oophorectomy, ito naman is the surgical removal of the ovaries and fallopian tubes and node sampling. So, take note, bilateral salpingo-oophorectomy. So, this is where fallopian tubes and ovaries are removed. Fallopian tubes. Salpingo is fallopian tubes. Ovaries is oophorectomy. So, salpingo-oophorectomy, fallopian tubes plus ovaries are removes. Okay? And of course, node sampling in order to assess the presence of malignancies or metastasis. Depending on the stage, the therapeutic approach is individualized and of course based on the staging. No? Type and differentiation, degree of invasion, and node involvement. So it always depends on the stage of what stage is the cancer or what stage the patient has. No? And whole pelvis radiotherapy, this is the whole pelvis is the region of the abdomen down to the thigh. Okay, that is the pelvis. Radiotherapy or radiation therapy is being done if there is a suspected spread of cancer cells to that certain organs of the body, especially in the pelvic region. Yeah. Pre-operative and post-operative treatments for stage 2 and beyond may include pelvic, abdominal, and vaginal intracavitary radiation. Or intracavitary, ibig sabihin yan, is inside the organ ang internal radiation na ang ginagawa dito sa intracavitary. Kasi intra means inside, cavitary is organ. No? So, that is for the medical and surgical management of uterine cancer. So, that ends our topic in cervical and uterine cancer.